Most people are familiar with the common symptoms of diabetes, such as excessive thirst, hunger, and urination. However, there are other, more serious symptoms that diabetics must be aware of and take steps to manage. Diabetes can cause serious damage to the body, including heart disease, stroke, kidney disease, nerve damage, and blindness. It is important for diabetics to monitor their blood sugar levels carefully and to follow their treatment plan to minimize the risk of these complications. Here in this video, we are talking about 6 most common diabetes symptoms that you should not ignore. Number 1. Excessive thirst. It is important to be proactive about your health and to know the symptoms of diabetes so that you can get treatment and support early. One symptom of diabetes that you should always be on the lookout for is excessive thirst. If you find yourself excessively thirsty, it could be a sign that your body is not able to properly regulate its blood sugar levels. This can lead to serious health complications if left untreated, so it is important to see a doctor if you experience this symptom. There are a number of things that can cause excessive thirst, so it is important to rule out other potential causes before assuming it is a symptom of diabetes. For example, if you have been sweating a lot or have been drinking alcohol, you may be dehydrated and just need to drink more fluids. However, if you are continually thirsty and are not able to quench your thirst, even after drinking a lot of fluids, this can be a sign of diabetes. Other symptoms of diabetes include feeling very tired, urinating more often, and having cuts or bruises that heal slowly. If you experience any of these symptoms, together with excessive thirst, it is important to see a doctor so that you can get a diagnosis and treatment. Having diabetes can be a challenge, but with the right treatment and support, it is possible to manage the condition and live a full and healthy life. Number 2. Frequent urination. When diabetes starts to manifest, one of the first and most noticeable symptoms is increased frequency of urination. This is because when blood sugar levels become too high, the body tries to remove the excess glucose through the urine. The process of urination also causes people with diabetes to feel very thirsty, as the body is trying to replenish the fluid that is being lost. Frequent urination can have a number of other associated symptoms, such as feeling very thirsty all the time, feeling very tired, weight loss, blurred vision. If you are experiencing any of these symptoms, it is important to speak to a doctor as soon as possible, as they could be indicative of diabetes. Number 3. Fatigue. One symptom of diabetes that often goes overlooked is fatigue. Feeling tired all the time is not normal, no matter how busy your schedule is or how little sleep you've been getting. If you're frequently exhausted, it could be a sign that your blood sugar is out of balance. When you have diabetes, your body has trouble converting food into energy. This is because either your pancreas isn't producing enough insulin, type 1 diabetes, or the insulin you are producing isn't working effectively, type 2 diabetes. As a result, your cells become starved for energy. This fatigue can be accompanied by other diabetes symptoms such as hunger, blurred vision, and weight loss. If you're experiencing any of these symptoms, it's important to contact your doctor right away. With early diagnosis and treatment, you can prevent fatigue from becoming a serious problem. There are a few things you can do to combat fatigue if you have diabetes. First, make sure you're taking your insulin or diabetes medication as prescribed. Second, eat a balanced diet and avoid processed foods. Eating foods that are high in fiber and complex carbohydrates can help to stabilize your blood sugar levels. Finally, exercise regularly. Exercise helps to increase your cell's sensitivity to insulin, which can help to improve your energy levels. If you're struggling with fatigue, don't ignore it. Contact your doctor and make sure you're doing everything you can to manage your diabetes. Number 4. Blurry vision. One symptom of diabetes that you must be aware of is blurry vision. When your blood sugar is high, it can cause fluid to build up in the tissues of your eyes. This can make your vision become blurred. If you experience blurred vision, it is important to see your doctor right away. They can perform a blood sugar test to determine if your blurred vision is due to diabetes. If you have diabetes, there are a few things you can do to try and prevent blurry vision. First, you should keep your blood sugar levels under control. This can be done by following a healthy diet and taking your medication as prescribed. If you experience blurred vision, you should also avoid rubbing your eyes. This can irritate the tissue and make the blurriness worse. If you have diabetes, you should see your eye doctor regularly. They can monitor your vision and help you catch any potential problems early. Blurry vision is just one of the many symptoms of diabetes. It is important to be aware of all the symptoms so that you can catch the disease early and get the treatment you need. Number 5. Weight loss. Weight loss is a symptom of diabetes that can occur for a number of reasons. If you are living with diabetes, it is important to be aware of the signs and symptoms of weight loss so that you can identify when it is happening and take steps to address the underlying cause. Weight loss can occur when there is an imbalance between the amount of insulin in the body and the amount of glucose in the bloodstream. When this happens, the body starts to burn fat for energy, which can lead to weight loss. Weight loss can also occur when the body is not able to absorb glucose from the diet, and this can lead to malnutrition. Weight loss can be a sign that your diabetes is not being controlled effectively. If you are losing weight, it is important to speak to your doctor or diabetes educator so that they can check your blood glucose levels and assess your diabetes management plan. Weight loss can be a difficult symptom to manage, but is important to try to maintain a healthy weight. There are a number of ways that you can do this, including following a healthy diet and exercising regularly. If you are struggling to manage your weight, speak to your doctor or diabetes educator for advice. Number 6. Slow healing wounds. If you have diabetes, you may notice that your wounds take longer to heal than they do for people who don't have diabetes. That's because high blood sugar levels can damage your blood vessels and nerves, which causes problems with blood flow and healing. If you have a wound that isn't healing properly, it's important to see your doctor so they can treat it and help prevent any complications. Here are 7 signs that your wound may not be healing properly. 1. The wound is red, swollen, or oozing pus. 2. The wound is hot to the touch. 3. The wound is larger than it was a few days ago. 4. The wound is deep or has pockets of dead tissue. 5. The edges of the wound are brittle or crumbly. 6. You have new pain or pain that gets worse. 7. The skin around the wound is red or has new rashes. If you have diabetes, you need to be vigilant about your health. This means paying attention to any changes in your body and seeking medical attention when necessary. Some symptoms that you should never ignore include feeling very thirsty, urinating often, feeling very tired, weight loss, and blurry vision. If you experience any of these symptoms, it is important to see a doctor right away, as they could be signs of serious complications. With proper care and treatment, however, most people with diabetes can live long and healthy lives.